the complete examination of a canine patient. Part 4, the systems exam. After the vital signs are documented in the medical record, it's time to perform a systematic physical exam. This is sometimes called the systems exam, as it focuses on assessing the health of the key body systems. The order that the individual components of the exam are evaluated is not as important as the necessity of being careful not to miss key findings in each system. The systems that we will individually evaluate during the exam are the sensory systems, integument, respiratory, cardiovascular, gastrointestinal, genitourinary, musculoskeletal, and neurologic systems. We will begin with the sensory systems. Beginning at the head, we will examine the patient's ears, eyes, nose, and throat. We will also assess the patient's oral health. The oral cavity is actually considered part of the gastrointestinal tract. However, for convenience, we can assess the oral health while we are focusing on the patient's head. Use an otoscope to check the ear canals for signs of infection, ear mites, polyps, and other masses. Verify that the eardrum is intact. Visually inspect the external ear pinnas and check for overall symmetry of the head and face. Check the eyes for discharge and verify the health of the conjunctiva. Perform a pupillary light reflex test on both eyes and check that pupils are symmetrical. The globes and irises should be identical in size and shape. Pigment may vary in each eye in certain breeds. The sclera should be white, clear, and free from inflammation and hypervascularization. Any abnormalities discovered should be noted, or NSF should be written on the examination report form. Check the nose for discharge, ulceration, hyperkeratinization of the external nares, and pigment loss or abnormality. Note any findings. Describe any discharge, if present, as clear, purulent, hemorrhagic, or mucopurulent. Evaluate the oral cavity for any periodontal disease and grade the disease on the standard 1 to 4 scale. Check for loose teeth, halitosis, inflammation of gingival or periodontal structures, the adequacy of the pet's occlusion, and any tumors or foreign bodies that might be present in the oral cavity. Examine the throat internally from the oral cavity, as well as by external palpation. Note any tonsillitis present, coughing on palpation, or detectable thyroid masses. Palpate the submandibular lymph nodes and salivary glands for enlargement or asymmetry.
So we're going to check first is our little mouth and evaluate everything there. We want to check back at these teeth. There's a little chip on her tooth. You see right there, she must have chipped, and want to be careful about what you're giving her to chew. Okay. Rawhides and the round, really hard bones are going to be a problem for those back molars. She does have a little bit of calculus. There's a little tartar and plaque there, not terrible, but those pockets are going to be an infection problem on either side. So we're going to have to kind of watch those teeth as time goes on, probably get those cleaned. And let's make sure everything else is okay on there. Oh, I'm sorry. Oh, I'm sorry. That looks okay down in it. We just got to make sure. Yeah. So those lymph nodes in that area are good. All right. We're going to take a look at the eyes and make sure that everything's okay there. All right, Winnie, that's a good baby. So we'll look at the retinas and we look at the optic nerve in the back too to make sure that we're not missing anything. Many times we can see some signs of diseases from blood vessels or even types of inflammatory diseases that affect the back of the eye. Mm-hmm. And so we try to get a handle on that to make sure we're not missing anything. And everything does look pretty good. Good comparison there was always important. All right, it's all right. Let me just make sure I don't see anything up here in the little nostrils. Okay, good. Awesome. And now we're going to take a look at the ears. Has she had any history of ear infections or shaking the head?
She has had a history of ear infections when she was a puppy.
Yeah, they're very common because of the allergy influences, and they secrete a lot of oils. Yes. Okay, stay, Winnie. That's a good baby. Yeah. She does have a little bit of wax and debris, mild inflammation, mostly on the outer ears. They're kind of sensitive,
Okay.
and that's expected. And actually, it looks like we always have one problem ear, and her problem ear is her left one. Yeah. Her right one doesn't appear to be too bad. So, but that's really common in a lot of pets. They always have one chronic ear that gives them problem with allergies. And so that's always an issue we have to deal with. Let me put a couple quick notes here on her.
Integument. The integumentary system includes the skin and hair coat. Examine the patient for hair loss or alopecia, matted hair, dermatitis such as seborrhea sicca, oleosa, ectoparasites such as fleas and ticks, wounds, and dermal masses. Note any abnormal findings, or use the abbreviations WNL or NSF if the integumentary system is healthy.
Because we're going to look at the skin and just kind of check to make sure, number one, there's no skin infection like a bacterial infection, but allergies are very, very common. And they can present with just generally itchy red skin or all the way to having infection problems. In the paws, you'll see the hair turns brown because they lick a lot, and that's allergy related, the contact dermatitis from walking around outside in the grass or just being outdoors. They're exposed to those little pollens and allergens all the time. I don't see an infection there, so that's good. It's a good girl. You want to lay down? Can you lay down for me? Come here, lay down. Lay down. Let's do this. There you go. So we want to look inside the thigh area and in between, on her little abdomen. This is where most of the skin infections actually show up. I don't see anything right now, so that's good. That looks clean. Other than a little dirt on my hair. But that's all right. It's being a dog. All right, good. Let's see underneath here. Let's see if there's any skin problems here. Okay, so the skin actually, other than the paw things, inflammation of the paws from licking and allergy contacts like that, that's good. There's no sign of infection.
Respiratory system. Auscultate the lungs for abnormal respiratory sounds. Describe in the physical exam report whether the abnormal lung sounds occur during inspiration, expiration, or both. Cardiovascular system. Auscultate the heart for arrhythmias, heart murmurs, and muffled heart sounds. Note any arrhythmia or abnormal heart sounds with the description on the physical exam form. The veterinarian will grade any murmur that is present on the standard 1 to 6 scale. The murmur will also be categorized as to location and type.
Okay, good. Well, the heart sounds nice and strong, consistent beat, no signs of a murmur or anything like that.
Okay.
That's good.
Because I had a previous pet that had heart
Oh, did you?
murmurs. Yes.
Ah, okay. Well, heart murmurs can be a big problem, especially in older pets. And if they were a younger dog, of course, we'd worry about congenital heart disease.
Right.
And in this breed in particular, there's a fair amount of congenital heart disease we have to be cognizant of.
Okay.
But a lot of our older pets will develop murmurs, and we usually grade them on the scale of 1 to 6, depending on how loud they sound, which can correlate well with the symptoms that we see in some dogs also when they come and present with that. But no murmur today, so that's a good thing. Yeah.
Lymphatic system. Palpate all 5 of the peripheral lymph node pairs and note any findings of enlargement or asymmetry. Normal lymph nodes are generally small enough to not be detected on palpation. Note the regions where any abnormal lymph nodes are felt. Submandibular, prescapular, axillary, inguinal, popliteal.
We're going to check the little lymph nodes out now. Come here, baby. Let's see what we got here. We're going to start up here and just kind of feel all the lymph nodes, because there's a lot of issues with golden retrievers also that have large lymph nodes that makes us concerned, that we sometimes have to check. So these little prescapular lymph nodes, and then we've got a bunch of lymph nodes underneath the jaw, submandibular lymph nodes. They all feel okay. Let's go back here and check the ones in the back leg. That one's normal on that side. Okay, you want to stand up? Huh? Okay, so get over here there, baby. Here, I'm going to stand up. Want to stand up? Here. That's even better. There you go, good girl. Let's feel that lymph node. And that one's normal. That's called a popliteal lymph node. And no large lymph nodes in the abdomen, the inguinal area. Good. All right.
Gastrointestinal system. Visually check the patient for abdominal distension, asymmetry, and bruising. Palpate the abdomen for tenderness, masses, enlargement, or irregularity of internal organs. Note any findings or use NSF if nothing unusual is discovered.
All right, and let me go ahead and let's feel the tummy. So we're going to feel the abdomen, make sure none of the organs feel enlarged and there's no pain in the abdomen, which would make us think about other problems in the organs and something we might have swallowed. But that's all good. So abdominal palpation feels good. The liver's normal size. No enlarged spleen, which is another big red flag for us if we feel something in that area that's overly large that can go along with a lot of illness issues. Okay, good.
Genitourinary system. Examine the genitals and perineum. Describe any abnormal findings for this part of the system's exam. Inspect external genitalia, testicles if intact, prepuce and penis, vulva, mammary regions on both females and males, and perianal area for masses, discharge, asymmetry, enlargement, herniation, urine scalding, or matted feces. Check the anal glands for impaction or fistula, and the anus for prolapse or polyps.
And we got to take a look at the little external genitalia, so I'm going to take a look at the privates here. Hold on, Winnie. Let's just kind of take a look around, make sure there's no problems here, no masses or infections. She's got a lot of hair back here, so a lot of times doggies can even develop skin infections around their private parts because of all the hair and the moisture it retains. Right. So we do have to keep an eye on that, and sometimes keeping them groomed and having them shave that back end is a good thing to minimize these problems.
Musculoskeletal system. Examine the limbs and joints for masses, reduced range of motion, crepitation, or muscle atrophy. Examine the spine for deviations and arched back, indicating spondylosis. Evaluating the gait and posture are important indicators of a healthy musculoskeletal system. Observe at a distance as the patient is walked around the exam room or treatment room. Deviations in the gait or posture may be associated with musculoskeletal problems, or they may be indicative of neurologic disease.
So if you haven't seen any problem with arthritis or stiffness or soreness, that's a good thing. But certainly as they age, it's very common that we'll see them start having a little soreness or just slow getting up and then warming up out of it. And you need to let us know about those little subtle changes. And you know, because a lot of these dogs will also, when they get to middle age, can have issues with their cruciate ligaments too. And that can be a real common problem. The kneecaps feel good there, so that's good. Let me check this little elbow and shoulder here. Yeah. All right, so that's good. And the shoulder joint doesn't seem to be a problem. Did she ever have any problems as a puppy growing, when she was rapidly growing with stiffness or soreness?
She did.
Did she? Okay.
Yes.
So that was probably a process called metabolic bone disease, which is common in larger breed dogs. And they can grow out of that, but it can set up a potential problem later on in life that we need to be just cognizant of, keep an eye out. Okay, good.
Neurologic. We will combine the subjective assessment of the pet's attitude and mentation noted earlier in the exam with objective measurements of reflexes, proprioception, and responses to environmental stimuli. Note any obvious limping and the favored limb. Check for ataxia. Describe any incoordination, goose-stepping, or knuckling. Record any findings if the pet is reluctant to move, walk, or jump. Describe any other proprioception deficits. The cranial nerves are located around the face, and abnormalities may show up in very subtle ways. Record a head tilt if present. Check for drooping eyelids, ears, or lips. These may be indicators of some form of cranial nerve injury. After the physical examination is complete, review your notes for omissions or entries that require clarification, and sign and timestamp the report. It will take a little practice to efficiently perform a thorough and proper physical examination. A pre-made entry form will be a great time saver in this routine, especially if the patient's signalment data are pre-populated. Instead of implementing this process in the exam room on your next sick animal appointment, try it out on hospitalized or boarding animals in the kennel on a slower day first. This report will ultimately become critical to making a proper diagnosis.